NHS should be there for all of us when we need it. And what I'm worried about with this strike action, as we've seen in previous strike actions, we will have appointments cancelled. There have been more than 1 million appointments cancelled since industrial action started last year. But also we know with emergency and urgent care that has real impacts as well. And so, as I've said throughout all my negotiations and discussions with the medical profession, I want us to reach fair and reasonable settlements. And I've managed to do that with consultants and with specialised doctors. I want to do the same with junior doctors, but them calling a strike and walking out of negotiations is not the way to secure that.
So will you offer them more than the 3% that's currently on the table?
Well, of course, last year, junior doctors, doctors in training, received pay rises of between 8.1 and 10.3%. So the most junior of doctors, the ones starting their first year, they saw a pay rise of 10.3% on their basic salary. But I want also to address their concerns about working conditions and so on. But I cannot do that if they're on the picket line rather than in hospitals looking after patients. And what this means for the NHS as a whole is that rather than us focusing on, for example, the winter challenges that we know are coming down the train tracks towards us, instead professionals around the country have been having to work intensively on how we can keep our hospitals and our health systems safe. And I wish that junior doctors the committee could come back to the table so that we can start those negotiations again and we can ensure that our hospitals continue to work as well as they possibly can over winter.
The longer this goes on, though, the greater the cost for the taxpayer. Shouldn't the government be looking at the bottom line here and actually deciding that we need to put more on the table?
Well, as I say, I have already found fair and reasonable settlements with both consultants and with specialised doctors. I want to do the same with junior doctors, but we also must look at what this means for other healthcare professionals and, of course, patients themselves. So this Christmas, we know that these strikes, if they continue today, tomorrow and on Friday, it will mean that people will stay in hospital longer than if these strikes had not happened, because hospitals will not be able to discharge them. So there will be people spending Christmas in hospital rather than at home. That is an enormous cost for individuals and for their families, but also for other members of the healthcare service, because junior doctors, the committee appear to expect consultants and others to pick up their work for them. And I'm very conscious, it's been a tough year for all our clinicians. I want them to be able to enjoy their Christmas and enjoy their rest as much as we all want to, but they're going to be picking up the slack for these doctors that are on strike.
Slightly different subject. Do you think it's time there should be another vote in the House of Commons on assisted dying?
This rightly is a matter for Parliament and for members of Parliament. It's a matter of conscience. I feel very honoured to be the Secretary of State for Health, but I'm also very aware of the responsibility that brings. And so it must be for Parliament, it must be for individual members of Parliament. And I can't be drawn on my own views because I wouldn't in any way want to preempt that discussion.
Would you like to see, for example, a commitment to a vote in the Conservative manifesto?
Again, this, I think, has to be a matter for Parliament. It's incredibly emotional, and there are a range of views on this, and we've seen, obviously, in the last couple of days, some of the impacts that very, very long-term, life-threatening conditions have on people and their families. And so I very much respect that it is Parliament's a matter for Parliament and a matter for individual MPs.
Except it's the government that timetables what happens in the House of Commons, isn't it?
Well, there are mechanisms, at the risk of getting very parliamentary techie. There, of course, there are private members' bills, and indeed the last vote on this was a private member's bill.
Okay, so from the government perspective, it's not something that you're going to be pushing for in the next few months?
It has to be a matter for Parliament, I think, and for individual MPs.